Welcome, Megan. How are you today?
I'm doing great. How are you?
Oh, fantastic. And where do you join us from?
I am joining you from Prescott, Arizona in the United States.
Beautiful. And what's the weather like over there?
Well, wildfire season has arrived, so
Oh,
the
wow.
air is a little bit hazy and it's very
Yeah.
windy, but upper 70s, it could be nice if it weren't for the wind and the smoke.
Yeah, we had a terrible bushfire seasons a couple of years ago now, and I still have memories of it. And terrible summer with polluted air, and then obviously the people that were affected by the bushfires. So we've just experienced a bout of floods. So we're just getting the other end of a drought and fires, and now floods.
Yikes.
Yeah. So I'm very excited to have you on the show, Megan, because what I'm excited about is I'm very passionate about mental health, and you approach mental health in terms of supporting someone's mental health from a different angle, an angle that I'm not familiar with. And that's why I'm really curious to find out more about what you do. You use art therapy to help support those that are experiencing burnout and I'm sure other sort of mental health issues. You use art therapy. So tell us a little bit more about what you do and how you've arrived at what you're doing today.
Well, the what I'm doing right now is I have a private practice providing online art therapy for helping professionals who identify with burnout, which would pretty much be all helping professionals these days. Um, and how I got here, a long time ago, all the adults in my life told me that I should be an artist, and I didn't want to be an artist because that's what people were telling me to do. So I had all sorts of other entertaining ideas of what I should do with my life. None of them were realistic and matched my abilities or interests even. So finally, by the time middle school was ending, high school was starting, I realized I need to do something with art, I guess, but what is it? I really didn't know. I just knew artists were only rich and famous after they died. So it didn't really sound like a promising career option. But then I was in high school and received some literature from a university that had a bachelor's program in art therapy, and it made perfect sense to me, the marriage of art and psychology. And I took another 2 years to think about it. But by the time I entered my last year of high school, I knew I am going to become an art therapist. And my guidance counselor at high school told my sister he was worried about me because I thought I knew what I wanted to do with my life. Which nowadays they want you to know that in kindergarten, when you're about 5. So anyhow, I double majored in art and psychology at the undergraduate level because in the US anyhow, you have to have a master's degree in art therapy to practice. So I double majored in art and psych just to knock out all of the prerequisites and be very expedient about this. And then I went and got my master's degree in art therapy. And that was 30 years ago. I'm board certified and registered here in the United States, licensed as a counselor in Arizona, Indiana, and Texas. Texas does acknowledge my art therapy existence, but that's kind of the road I took to become an art therapist. Was I knew what I was doing. And how I became involved in doing exactly what I'm doing today. Some years ago, I began to be very dissatisfied with the professional development that was available for people like myself. All of the continuing education opportunities for therapists were geared toward talk therapists because they outnumber art therapists very easily. So there was just this place in me that wasn't being reached. And I realized the place in me that's not being reached is the part of me that's a person. And so I opened up a side business with, no business training or expertise or anything, opened up a side business providing art-based professional development to therapists. And the goal was to help them work on the person of the therapist because, as is the case in many professions, there's imposter syndrome and the sense that, if I just take one more class, I'll be excellent, instead of miserable and befuddling like I am right now. So I wanted to help them connect with, no, it's the person of you. Mental health treatment starts with the person of the therapist. It's not the tricks you know and where you went to school and all that. It's who is the client connecting with, the person of the therapist. So that was my intention. That did not fly. What people wanted were more tricks and techniques, and they thought I could teach them art tricks to help them get over their imposter syndrome, essentially. But that did not work. And I eventually wound up teaching at a university and saw that student mental health professionals are clearly not prepared to deal with compassion fatigue, vicarious traumatization, secondary traumatic stress, all the companion syndromes to burnout that it happens in a helping profession. They weren't prepared at all. They were just anxious and felt like they didn't know what they were doing, and then they graduated. And that seems like a real crime to me. And in the meantime, the pandemic kicked in, and my appointment at the university was temporary. So I needed to do what would come next. There were hiring freezes all over the place because nobody knew what was going to happen with this pandemic. And so I decided, I guess it's time for me to go into business for myself. I got some real business coaching, so I can hopefully stay afloat. But that is why I decided, no, I'm taking that little side business I did and I'm expanding it to all helping professionals, because it's the person of the helping professional who hasn't been acknowledged in any of the crisis, the trauma of the pandemic. Helping professionals were perched precariously at the edge of a cliff before the pandemic kicked in because they never were taught how to take care of the person of the helping professional. So that's why I am doing what I'm doing today. And because the pandemic introduced everyone to, hey, we have technology, why aren't we using it? It's amazing because now I can work with people who are very far away from me, whereas before it was, who's within driving distance. So it's a fabulous way to reach people who really need to be reached. And helping professionals are so busy that even just going to a therapist's office and driving back, sometimes that's just not feasible for them. So online is actually more helpful to them. It helps get the service to the person who needs it.
And so how does art therapy work for those helping professions that are burnt out?
Well, first of all, we have to take a look at how art therapy works. And then we tackle the second part of that question, is kind of the population specific. A lot of people erroneously think that art therapy is like talk therapy with some art in it. Make a drawing of what you're feeling and then we'll talk about it, or make a collage of the things you like and then we'll talk about it. So it's this can opener approach where the therapist is using art to make the client say more words, which makes sense. A talk therapist has been trained to deliver treatment through words, so they're going to do what they can to drive treatment toward words. But art therapy is not about the words. In fact, we think not in words. We think more in images and impressions and representations. And so in art therapy, you can actually step in and work with those mental images that eventually, if they reach conscious awareness, they become our words and our behaviors and that sort of thing. But they don't always reach a level of conscious awareness, and they're hanging out as our feelings or as our reactions, our behaviors that we're not particularly aware of. And so in art therapy, you're not just asking someone to spit it out. You're actually working with them to bring those images forth. And the materials and methods that you use actually can create shifts in mental imagery. There's a whole mental image formation process that has physical components as well as emotional components. And most of those things aren't available to conscious awareness. In fact, very little of our full mental activity is conscious at all. So art therapy is not about working with what you are conscious of. It's actually going deeper. And when you think about all of our life experiences, our nervous system store as impressions or imagery, there's just a treasure trove of images inside of us. And when we have unfortunate experiences, such as burnout, those images are trapped inside and need to be dealt with. In art therapy, you can actually get them out and not just talk about them. You can get them out and sort of recreate them. So you are sending direct message through your hands. So we've got somatosensory processing going on. And through your eyes, that's visual perception. Visual perception is very linked to memory. So you're using a whole lot more of what nature gave you, basically, to recreate what's inside of you. And so that's the magic of art therapy. It is not about, let's make some art. In fact, I tell people it almost doesn't have anything to do with art. We're just using art to get to where we need to go. So it's not about pretty pictures or aesthetics. That's art school.
And I was just thinking, Megan, as you were saying that, like I was hopeless at art at school, and I actually detested it. And so my thinking is, would it actually help someone that's not good at art? And I think I know what the answer is, but I'll let you answer it.
Well, first of all, I want to say that the way you detested art might have had to do with a bad art teacher who wasn't very supportive. So it wasn't really about you. It was that other person. So art therapy is for everybody. And a lot of people are afraid, I will look stupid. I will look like I'm 9 years old or 7 years old or 4 years old if I do this. Well, maybe something happened to you when you were that age that we actually need to address, because you seem to be afraid of being discovered. That being said, professional artists can be very hard to work with in art therapy because they've got ego invested in their product and they don't want to look at it in any other way than as this sign of their own success. So it's actually a little easier to work with someone who has less emotional attachment to their artwork and they're willing to just go in there and put some stuff together and just start moving their bodies and seeing what comes out and then going from there.
And so I'm just trying to visualize or, understand how a session would work. So like someone that comes to see you, they're telling you, look, I'm exhausted. I've been working nonstop. I'm very frazzled. I'm not sleeping. I'm, just staying awake, thinking at night. And then I have no energy the next day and loading up with coffee and energy drinks to keep me going. Then I collapse at the end of the day and this vicious cycle just goes on and on. So how would you then talk to that person as to get them, I guess, to then start writing down the images they see? I'm just wanting to sort of step through the process a little bit here.
Well, since I am working with people online, I ask them to provide the art materials. And I encourage people to not go shopping. Look around your house. What do you have? Do you have tinfoil? Do you have rubber bands? Do you have pens and markers? And highlighters? Do you have your children's silly putty or whatever? If your children will let you borrow it. But I want to see what their brain thinks of, because part of what I'm attempting to do in art therapy is getting them to expand their capacity for thinking. Burnout leaves you with nothing left but shortcuts. You have no energy. You can't think, what's for dinner? The same thing I have every night for dinner. It's that kind of thing. So I'm trying to get them to expand. So if they can start looking around their house for, oh yeah, I've got some computer paper that's only been used on one side, I could recycle that. If I can get them to start thinking in this way, we're starting to get on the right path. And then what I do is I ask them to, let's talk about what you've brought, the materials you've brought, because I can kind of help them learn to think about those materials in a way that gives me information about, do they tend to use materials in a way to express what's inside, or do they tend to bring materials to the table that are going to help them with emotional containment? And both are important, but you want a balance. So then I ask them to just create in my presence. We use 2 cameras each. One is trained on the faces and the other one is trained on the working surface. So I can see their hands and what their hands are creating and matching that up with the face. That's all data for me. But what we get out of that is I start looking at the way their brain processes information. at physical levels, emotional, and intellectual. And I look for where's the breakdown. So the story you just told me, I'm exhausted, I'm getting by on coffee, and there's zero sleep, and da 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 da. That would describe just about anybody. But you can't take two people with that story and expect that their whole nervous system is experiencing the exact same thing. So I can't give somebody the same treatment I gave the other person. I have to see what's going on within their nervous system. I particularly was trained on a model called the expressive therapies continuum, and most art therapists were not, but they were trained in something else. But this is about how does the brain process information, both non-conscious material and conscious material, and looking for those patterns of information processing and seeing where's the breakdown. Because what you're describing could be a breakdown anywhere. And, there's kinesthetic, which is going to be your motor output and your ability to regulate your tension and raise your energy when you need to. There's sensory, which is self-soothing and the ability to sustain focus and attention. There is perceptual information processing, which is how your brain builds an internal map of the outside world. So it's pattern matching. And that's going to be about structure and routine. Then there's affective information processing. That's going to be about not just feelings and mood, but also motivation. And then we have cognitive information processing. That's what it sounds like. It's logical, linear. How are you doing in that part? Can you think things through clearly? Do you have problems anticipating consequences? That sort of thing. And then lastly, we have symbolic information processing, which is meaning, personal meaning, and insight and self-awareness. And part of being self-aware is knowing what your strengths are. And usually someone who is receiving treatment for burnout, they have no idea what their strengths are. So I need to see what's the relationship between all these 6 areas of information processing so I can find where are we strong, where are we almost non-existent, because my job then is to create interventions for them to help weave that whole picture back together, all those 6 components I just named. Because smooth functioning means you can process whatever information you need to through your body, through your emotions, through your thinking process. So that was a long answer to your question. The short answer is there's not a one size fits all.
And that's pleasing to hear. It's it's individualized treatment to the person because they're completely unique and different to anyone else, and they experience burnout, as you said, in a different way. No two people have the exact same experience of burnout. There's some common symptoms, but as to what's driving it, it's that's where you go is and you through the picture. So I'm just thinking that initial picture that you create together, you get a better understanding of the person and the issues. And in terms of the treatment, do you actually create a picture, help them create a picture of what they want or what they what's a better image, or what's the process from, I guess, understanding the issue and the drivers and you get their strengths, you get their weaknesses, and then do you go through a construction process with them to rebuild these images, or what is it?
Yes. And that's going to be individualized. It depends on what the person's goal is. So we have to, that's called the treatment plan. Make the treatment plan involving their goals and also involving what I see. Well, okay, you want that, and I see we're challenged over in this area, and we really have to build that in order to get to where you want. So a lot of times it's always about starting where they're strong. Where are they strong in their information processing pattern? We start where they're strong because that's where people are comfortable. And you don't get anywhere by starting where they're uncomfortable. That's the problem. So we start where they're comfortable, and then we gradually shift art materials and the methods we're using, because it's not about making the art stuff. It's really about what's happening inside the body and the brain, the nervous system. So I'm essentially just weaving together the areas of their their ability to process what's happening in the world around them and all their experiences. In burnout, there's so much shutting down of all that. You're usually just processing what you're strong at processing. The rest falls by the wayside. So for some, it may be, they may prefer to work in a way that's, I'm going to draw something and now we're going to kind of unpack it. And now I would like to redraw this or resculpt this, whatever it is, taking away the part I don't like and adding something I do like. Some people really want to work at that level. Some don't. Some want to work with far less words. That's where it gets down to just sensing what works best for each person. So I don't have again, there's not a one size fits all. Some people want to take the voice of the art. They'll speak for it. Some people will find that to be stupid and insulting. So there are many, many paths.
I can understand. Like in terms of, I'm thinking of the pictures I would draw is sort of like those stick creatures, like they're very, very simple art, but not very detailed. Yeah, just sort of, I guess that's my extent of my creativity is sort of stick creatures and just, simple drawings. But you probably think that, there's probably a way in which I think in terms of simplicity. I don't know.
Well, but there are other ways to create as well.
Yeah, that's true.
You can take a few sheets of paper of different colors, tear them up, and then glue them back together into some assemblage of something. So it doesn't have to, it's definitely not always about drawing.
Yeah, so you can be using materials and build things with materials. Is that, part of art therapy?
Oh, definitely.
Yeah,
definitely. Yeah. That's why there needs to be a range of materials. If I were seeing clients in office, I would have to have a range of materials, things that we call resistive, where you can press on them and they will kind of support that. And then materials where we call them fluid, where, like think watercolors, finger paints, that sort of thing, where it runs away on you. And so for the people who really, really like to work with fluid materials, maybe what we really need to do is gradually titrate toward working toward resistive materials, because that could be tapping into those areas of challenge inside. And conversely, someone who only wants to work with resistive materials, they only work with black and white pencil. Part of their challenge may be the spontaneity and the lack of control of the fluid materials is where they're struggling, and we need to move them toward that very gradually. So again, it's not about the art and the art materials, it's about what is happening inside.
Do you find that it works better for some individuals and not so great for others? Like, is there a type of person that it's really supportive for? Or, generally, we know about talk therapy. Art therapy is not so common. Is it really effective with a certain type of individual, or that's not the case? It works for everyone.
I would be cautious about saying that there is a therapy that works for everybody. I think the reason why there are so many different approaches to therapy is because there are so many different people who need different approaches. And like I said before, professional artists can be very difficult to work with. They're very resistive. They do not want their art to be used in a different way than what they're used to. I think the people that are kind of the best fit for art therapy are people who are curious and willing to suspend their judgment and just sort of know there's something inside that I need to see. I don't know what it is, but there's some part of me I need to see. And that's one of the beauties of art therapy. In talk therapy, the words drift away unless you've recorded the session, which you mostly should not be doing. It's kind of unethical. But in art therapy, you have this residual product that can remind you of the changes that you are making inside. And you can kind of track your own progress and be reminded. It's so easy for people to forget that they've made progress, that having that visual record very tangible is concrete evidence of, wow, look how far I've come. So, and that's not necessarily reflected in, look, I can I can draw better because art therapy is not about art lessons. It's just really, wow. I remember that image that was made back when I was going through such and such. And now look at this image. The colors are totally different. My line quality has changed. Something inside me is moving. So those external reminders of progress can be great, especially for people who, like I said, they know there's something inside and they just want to see it. This kind of gives them that satisfaction.
Do you find it is more those past events, like long back, like maybe childhood traumas or experiences that you find emerging through art therapy? Given that they're looking for that long lost image, or they want to know what it looks like. Is there any correlation there, or not really?
Sometimes, and it's really up to the art therapist's discretion, given whatever the treatment setting is. I used to work for a school district, and in that setting, my students all went back to class when they were done with me. So it was not an appropriate place for digging into the weeds of their stuff. In art therapy, you can actually do that without words and without conscious attention to it. So I could also kind of help them contain it so that when they went back to class, they were fine and ready to go back to class. They weren't raw from having had a therapy session. So it's sort of working covertly. And some people are in therapy because they want to know, they want all that stuff to come forward. They know it's in there somewhere. And some people know, this is what I want to work on. I don't want to work on all that other stuff. And so they don't have to. And generally speaking, troubling images only start emerging when you're ready to deal with them. You know, your brain has a natural ability to sort of determine when that is. So most people who are, I have this history of blah, 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 I don't want to look at all those images, you're not going to, because you're not going to produce them.
And in terms of other mental health concerns, or, like I'm thinking people with chronic depression, or generalized anxiety disorder, which is prevalent today. Does art therapy work for anything else other than burnout?
Oh, yes. Yeah, it is a treatment that is across the board. So lots of research going on, art therapy and autism spectrum disorder, art therapy and Alzheimer's disease, dementia, traumatic brain injury, post-traumatic stress disorder. It runs the gamut, just like talk therapy does. It's just a different way of getting at what's going on inside the person.
And how about ADHD and any of those attention deficit disorder conditions for children?
Yeah. And the kind of the full range of neuroatypicality, can be addressed through art therapy.
Oh, wow. It's exciting to know it's out there, because, it's not common that people talk about, I'm getting help using art therapy for my mental concern. So it's really great to that you're sharing it and you actually specialise in this area. Megan, how can the listeners best connect with you?
They can visit my website. I'll spell that out. It's www.meganvanmeter.com.
And for the listeners, I'll certainly include the website link directly in the show notes. So you can just go to the show notes, click on the link, and it'll take you directly to Megan's website. And Megan, have you got any words of wisdom you'd like to share with the listeners?
If you are a helping professional who identifies with burnout, I want you to know it is not your fault. I think that's one of the most important messages that our heroes can understand, that they just were not prepared to deal with the stuff they were dealing with before the pandemic kicked in. And so I think those would be my words of wisdom. And there is always hope. You can always burn bright. You can always burn bright, but you may need to reach out and ask for a little bit of support with that. And there's nothing wrong with that. Helping professionals are very bad at asking for help. It's one of our shortcomings. I'm speaking as a helping professional myself. But yeah, it is not your fault.
And such great words to finish the episode in terms of you can actually burn bright. And I really like those words that you pulled together to really, summarize how you help and bring people out from the brink of burnout to shining bright, which is fabulous. And to the listeners, thank you so much for tuning in to another insightful episode of Me and My Health Up. Stay tuned in for more exciting episodes of Me and My Health Up. And in the meantime, if you've loved the episode, please share it with others. This is all about getting this information, making people more aware of these alternate therapies that are available to people that could be the therapy that really works for them. So please share it, like it, leave us a review, and it will get to more people. So thanks again, and thank you, Megan.
You're welcome. Thank you.